Welcome back to Mental Health Through Will Training by Abraham A. Lowe. This is Section 2, Chapter 7, Temperament and Temper. Betty, on the Saturday afternoon panel reported that several weeks ago she had an appointment to see Dr. Lowe at his office. I had to wait from 2:30 to 4 p.m. Then I had to go shopping for a belt and a pair of shoes. After that, I had to go to the insurance office and to be there before closing time. At the department store, I had to spend time picking the merchandise I wanted. Then it took more time yet before the sales lady took care of the purchase. I got to the insurance office just 5 minutes before closing time. By now, I had a severe headache, and when I was on the street, it occurred to me that I had to get a few things for supper, and that after supper, I had to attend the monthly recovery meeting of the panel members in the evening. The head pressure became worse, and I felt exhausted. Finally, I arrived home trembling and sweating and palpitating. Then I noticed that my husband had not returned from work, although it was past his usual time. My first thought was that something had happened to him. My symptoms became worse. Then I remembered my recovery training and thought I shouldn't anticipate danger. Instantly, I felt better. Betty, in an emotional upheaval, summoned forth a slogan she had learned in recovery and obtained instant relief. Experiences of this kind are now commonplace among our members. They know that all they have to do to stop emerging symptoms is to spot their emotionalism and to refuse to accept the suggestions of doom and disaster offered by their temperamental lingo. And if Betty managed to secure instant relief from her spotting the conclusion, it seems inevitable that she spotted correctly and applied the appropriate technique taught her in recovery. But recovery techniques and recovery maxims stem from me, your physician, and if it is true that I ever taught Betty or anyone else not to anticipate danger, I must have been dreaming or utterly careless in my choice of words. How dreaming it how can anybody be alive and avoid anticipating danger? To be heedless of danger is a sure prescription for running straight into it. Just cross streets and turn corners unmindfully in the dangers of a busy traffic, and I will not want to be responsible for what might happen to you someday. Clearly, Betty applied her recovery slogan correctly, but in quoting it, distorted its phrasing. No wife worth the name can avoid uneasy thoughts and anxious anticipations if her husband is unduly late in arriving at the customary time. The image of an accident, of collapse, and even misgivings about foul play must of necessity arise in her brain if she is possessed of affection and imagination. In a situation of this kind, the thought of possible danger is unavoidable, and a proper response. No teaching of any kind, recovery or otherwise, will ever be able to eliminate this response, which is necessary for life and desirable for human relations. The question is how a person experiencing the response of apprehension will react to the experience. Will he worry with reflective calm, or will he work himself up to a burst of emotional hysteria? If he permits himself to become emotional and hysterical, then the original response of plain worry has been worked up or processed into temper reaction. What patients are taught in recovery is to curb their tempers and to leave the original responses to run their course. That is, to let them rise and fall, come and go. Temper keeps them rising and coming and prevents them from falling and going. What I hear call original responses are the ordinary run of thoughts, feelings, sensations, and impulses, which, in the average individual, come and go, rise and fall. They are inherited and constitutional. A dog jumps at you unexpectedly. You are startled, and in the startle is the original response which everybody is likely to experience in an event of this kind. It would be absurd to tell you not to get startled. The response is rooted in your racial inheritance, embedded in your constitution. It is original, natural, and hardly changeable. Another example. Your ear is assailed by a harsh word, or your eye by a disdainful gesture. If you are at all responsive, you will feel hurt or insulted or shocked. That is again your original response, just as constitutional and refractory to change as it is to startle as the startle occasioned by the dog's jump. Original response of this kind are without number. The pity aroused by suffering, the joy and warmth produced by a smiling infant, the enthusiasm created by a stirring speech, the delight felt at the sight of a friend, the anger provoked by an affront, the impulse to run in the face of danger. These and a multitude of others are all original responses. The sum total of original responses which a person is possessed or capable of are called his temperament. Temperament means that a person is sensitive, receptive, impressionable to events inside and outside of himself. If your temperament is receptive and impressionable, your original responses will be many and varied. If it is dull, they will be few and static. It is temperament which responds to events with readiness or sluggishness, warmth or coolness, sympathy or aversion, interest or indolence, thrill or chill. When Betty, arriving home, found her husband missing, the thought struck her that something might have happened to him. Every wife would or should have experienced the same response, provided her temperament was endowed with the average qualities of warmth, affection, and tenderness. If Betty's temperament was what was of his description, she had to feel concern, worry, or misgivings. You see here that when temperament stirs feelings, are apt to rise. Temperament stirs, feelings are apt to rise. In the present instance, the feeling was that of worry. Betty might have acted on this natural and original response of worry. She might have telephoned to the husband's place of employment, or to any locality at which she could have reasonably expected him to stop on his way home. Had she done that, her original response would have guided her to a rational, sane, well adjusted reaction. Or she might have analyzed the situation in light of previous experience and reflected that her husband's arrival had been delayed frequently in the past by overtime work, by traffic jam, or by a decision to have his hair trimmed before setting out on his homebound trip. This again would have led to a rational, sane reaction. Betty's temperament was not disposed to release the responses of calm impatience. She is and was a nervous patient, and if the temperament of the nervous patient stirs, it is likely to develop temper. And you know that temper is incompatible with calm and patience. Temperament raises mild and moderate fears, worries, and angers and joys, but temper acts differently. Its responses are always vehement, immoderate, excessive, and even explosive. In her pre recovery days, Betty responded to disappointments with temper. After she had gone through her recovery training, her responses became again those of her native temperament, calm, even, sane. In former days, her temperament led her straightway into hysterical emotionalism. Now it produces feelings of average intensity. Formerly, when disappointed, her temper suggested a grave emergency. Now her temperament merely hints at the possibility of average danger. To think of danger calmly is undoubtedly wholesome and necessary in life in general, but particularly so in the hustle and bustle of our metropolitan life. Why then did Barry think she should I'm sorry, Betty. Why didn't Betty think that she shouldn't anticipate danger? Obviously, she confused two types of anticipation, those generated by a wild temper and those inspired by a mild temperament. In recovery, she was taught not to entertain hysterical anticipations in response to average dangers, which merely call for gentle and moderate worry. When she met with the average situation mentioned in her panel example, her temperament produced the original response of concern, but unwittingly and following a year-long tendency, she thought of a dire emergency and developed temper. The result was that her symptoms became worse. Now she remembered her recovery training, spotted her temper, and felt instant relief. She acted correctly when she reported the event but she used a wrong phrasing. She claimed she spotted and stopped her temperament when, in actual fact, she put a stop to her temper. She applied properly the recovery techniques for curbing temper, but misquoted the implied principle when she presumed to have checked her temperament. My patients will do well to ponder the lesson of this clear-cut distinction between temperament and temper. Afflicted with nervous ailments, they are extremely sensitive to the original responses of their native temperament and are aroused by actions and our temperament are aroused by actions, statements, and events which other people, less impressionable, would overlook and ignore. Somebody maintains silence in their presence. Instantly, my patients are likely to construe the reaction as slur or indifference or neglect, or they commit a minor blunder or sustain minor losses, failures, or defeats. The average person would take these insignificant mishaps in stride, and not a ripple of excitement might cross his temperament. But my patients are apt to respond with self blame, embarrassment, or a sense of inefficiency. This is in itself no calamity, and merely indicates that my patients are unfortunately blessed with temperaments which pour forth endlessly streams of original responses. The responses as such are no wise different from those experienced by men and women, not the victims of nervous trouble. Everybody may at any time feel slurred or neglected, and may on occasion indulge in self blame and a sense of embarrassment. With the average person, such common inner disturbances are readily forgotten or dismissed. But with my patients, there are no minor or common disturbances. Every disturbance has to them the major aspect of an urgent emergency. And if an emergency is thought of, emotion is mobilized and temper released. Minor apprehensions are there then fanned into major explosions, into panics and tantrums. These dramatic and dramatized developments can be checked in the patient is if the patient is trained to regard his worries, embarrassments, misgivings, and forebodings as what they really are, the innocent outpouring of temperament, which has been sensitized by an endless career of suffering and has acquired the habit of producing an unbroken succession of harmless original responses. The nervous patient will have to learn to be tolerant of his responses and to refrain from processing temperament into temper. Thank you. That was it for that chapter. Next time we're going to read Temper Masquerading as Feeling. Thank you.